Oh, here we go.
Well, we don't
It
have the
should
H
be,
slide in our PowerPoint.
you do. It's actually in slide 17 of what PowerPoint is this? I think this is
I think
part
number 2.
part two. 17 of part 2. You should be able to see it.
The H?
Yep, it will kind of look like an H. Let me see if
Oh, right there.
my computer will let me share this with you. Apps and okay. Can you guys see my screen okay?
Yeah.
Yeah? Okay. Oops. All right. So here's that median antebrachial artery I was talking about. Here's the cephalic vein, right? So this is like the upper portion of the H right here, the cephalic vein. And then here, the median cubital artery is kind of like the bridge of the H. And then if I move my face over here, it'll let me. There we go. Over here, you have the basilic vein. So see how it makes kind of an H formation. So those are the veins to know in that cubital fossa area, are the cephalic, the median cubital, and basilic. And I gotta figure out how to stop sharing now.
So for y'all's lecture quiz, is he expecting y'all to know like all the slides that you sent us?
I think so.
I'm trying to stop sharing and my computer is going. Here we go. Perfect. All right. What was the other thing you said, Mark, besides the cubital fossa? Those are the main things that I would know as far as cubital fossa goes.
The axilla area.
Okay.
Axilla.
Give me a second. Unless Aaron and Matthew, you've got things that you want to chime in on the axilla area. I'm just looking at my notes here.
I would think the arteries that we went over last time. So like the arteries coming from the kind of the subclavian are pretty important. I'm trying to find a slide. And kind of like where they divide. But we still could kind of do that list, and not, I mean, after this, because he said that for the lecture quiz, I think they're still expected to know
Sounds good.
everything that we kind of had on the list.
Yeah, I mean, whatever you guys got on that list, you think we should know.
What is
Yeah, I can't find the PowerPoint.
Yeah, I'm trying to find it in my notes. Y'all have, the way he's organized your class is a little bit different, so I have to wade through my notes and where exactly it is.
Yeah, he's got long PowerPoints and even longer recorded PowerPoints.
No, yeah, I heard you guys went over quite a bit today.
Yeah.
Like by 30 minutes or so.
But
yeah,
today was definitely
and relax.
Okay, let's see. I've got quite a bit on the axilla, but we can go with what we got here. Okay. So let's see. All right, so to start off with, just in general, the axilla is, oh, where'd it go? Okay, the axilla is a gateway to the upper limbs, so it helps with communication from the neck to the upper extremities, the pectoral region, and the shoulder region. So there's the pyramidal space, which is inferior to the glenohumeral joint and superior to the axillary fascia. And it's at the junction of the arm and the thorax.
Sorry,
Makes
could you
sense?
repeat
So
that,
pyramidal
please?
space, huh?
Could you repeat that again, please? It's from the beginning.
Yes, no problem. So pyramidal space is inferior to the glenohumeral joint, and it's superior to the axillary fascia. It's at the junction of the arm and the thorax. We'll go into that a little bit more in detail because you'll want to know the borders and all that fun stuff. Okay, so again, this is kind of just general stuff. It provides a passageway that's usually protected by the adducted upper limb for the neurovascular structures that serve the upper limb. So here are some of the neurovasculature of the axilla. So at the root of the neck, you have the cervical axillary canal. And then in the pectoral region, so in the anterior part of the axilla, you have the I'm probably not saying this the best, but the clavipectoral triangle. And let's see. In the scapular
That's where you
region,
can.
again, we'll go over this. Huh?
I was just gonna say that triangle you were talking about, the clavio-pectoral triangle. That's where you can palpitate the coordinate process, right?
Yes, that's where you can palpate it. Okay, and again, we'll go into this a little bit more in detail when we go over, but in the scapular region, there's the quadrangular space, and we'll talk about the borders of that in just a moment. Okay,
Are you sharing
so
your screen right now?
is what?
Are you sharing your screen right now?
I don't think I am.
Oh, okay. Cause I'm over here trying to swipe over, but nothing's showing up. Never disregard me.
Yeah, okay. No worries. Yeah, I was like, I don't think I'm sharing my screen. Okay, so let's see. The boundaries of the axilla now. So this is going to have 1, 2, 3, 4, 5, 6 components to it. So first one is the apex. So the apex of the axilla has the axillary inlet, the posterior border of the clavicle, the superior border of the scapula, and the lateral margin of the first rib. So apex has axillary inlet, posterior border of clavicle, superior border of scapula, and lateral margin of rib. Okay, and then the base is what's considered the true armpit. So this is going to have subcutaneous fat, and then axillary fascia, and then this is also where we're going to have like hairy skin. Okay, yeah, we'll get to that in just a moment as far as
Are we
the
on the
borders.
quadrangular?
I'm not at this space yet. I'm just
Oh,
going over
okay.
I'll get there in a moment though.
All right.
I'm talking about just the boundaries of the axilla.
Okay.
But yeah, I'm about to go over that in just a moment. Okay, so then you have your anterior wall. We haven't gone over that yet, right? Everybody cool with the apex and the base so far?
Yeah.
Okay, sweet deal. So next is the anterior wall, and the anterior wall is the anterior-most part, obviously, but it's made up of 3 muscles. So you've got your pec major, pec minor, and subclavius. All right. Then posterior wall is subscapularis, teres major, and latissimus dorsi. 2 more.
Can
The
you repeat
next
that
one
one real
is,
quick, please?
yeah, no problem. So posterior wall is the subscapularis, teres major, and latissimus dorsi. There we go. Thanks,
Yeah, I found it.
Aaron or Matthew. I don't know who's doing that, but yeah, this is This
These
slide,
are
I
from the
don't
end.
see, this isn't on theirs, is it?
No, but this is from ours.
Yeah. This is the slide that I'm referencing basically. Okay. And then let's see here. Lateral or medial wall is the next thing. And now you have a list right in front of you. I should have shared my screen. But okay, so medial wall are ribs 1 through 4. And then the upper 3 intercostal muscles and serratus anterior. Then the lateral wall would be the intertrabecular groove. Did someone say something?
Can you repeat that one more time? Sorry.
Yeah, no worries. It's all good. Then medial wall, is that what you needed me to repeat?
Yes.
Yeah, no problem. So it's ribs 1 through 4. The upper 3 intercostal muscles, so that's just the muscles that are in between your ribs. And then your serratus anterior muscle. That's the muscle that comes right in here. It's also known as like the boxing muscle. And then the lateral wall is your intertrabecular groove. Now, the reason why something like knowing these things might be important is, let's say, again, like we said, our professor loved asking questions like, if there was a stab to the anterior wall of the axilla, what muscle would not be involved? So just knowing that kind of thing is how that might be correlated into a question. Let's see. And just think of what else might be important in the axilla. Let's see, Aaron or Matthew, do you guys want to share
I mean, I
anything that
can
you
go
think is
over the contents. I mean, I'm mostly gonna probably just read off the slide. The Axle is not, I would say, my forte, but since your slides don't really have words, I think it's better if we kind of just go over the list of some of these contents here. The axle is going to have that clavipectoral fascia, which is going to be that CT sheath over your, it connects your clavicle and the floor of your axilla. So inside that fascia, you're going to find your subclavius and your pec minor muscles. And then veins and arteries in there would be your cephalic vein, the pectoral branch of your thoracoacromial artery, and your lateral pectoral nerve. And that's between, those ones that I just listed are between the subclavius and the pec minor. And then stuff below the pec minor include the lateral thoracic artery and the medial pectoral nerve. Right? So obviously I wrote a lot on this slide, so I'm pretty sure it's going to be important. So these are just branches off. Yeah, these are branches off your axillary artery. So you're going to have 6 branches off your axillary artery. And the axillary artery is a continuation of your subclavian. So once you pass into the axillary area, your subclavian is going to turn into your axillary artery. So those 6 branches are, I'm pretty sure we might have made a mnemonic or something to memorize the branches. I don't know. I don't remember the mnemonic I used, but it's good to always try to create your own mnemonics to try to memorize these things. But the 6 branches are the superior thoracic artery, your thoracoacromial artery, your lateral thoracic artery, subscapular artery, posterior humeral circumflex artery, and your anterior humeral circumflex artery. And yeah, so this lateral thoracic artery runs alongside your long thoracic nerve. So if I have an injury to my long thoracic nerve, I could potentially have an injury to my lateral thoracic artery as well, if that makes any sense. So he could ask a question, be like, okay, I'm experiencing wing scapula, which is innervated by my long thoracic nerve. So you would say, or I'm experiencing wing scapula, what artery could be damaged? And it would be your lateral thoracic artery. because it runs alongside your long thoracic nerve. Yeah, so that's the contents of your axilla. Aaron, if you wanted to go over those spaces, I think they should definitely know those as well.
Going off that slide. Scroll down like one more slide. Maybe a couple more.
Yeah, it's down here.
I completely went off of it trying to find something else.
There it is.
There you go.
So I would know. Oh shoot! What the heck? I would know these spaces because he can easily ask a question on their contents. Aaron, if you want to go over these.
Did he mention these at all to y'all?
Yeah.
These spaces?
Mm-hmm.
He did. Okay.
I was gonna say, I think I saw it in your guys' slides.
Yeah. So you want to scroll up one?
The triangular and quadrangle space.
Correct.
Yeah. I'm not sure where this is on y'all's slides, but
I can try looking for it.
would it help
It
y'all
was-
if we just sent y'all like our PowerPoints?
Yes, can you please do that?
Yeah.
I was thinking, please.
I was gonna
Okay,
say,
well.
I think what we could do is put them where we talked about last week, how we have a Dropbox. If you go into
Could
the tutor section and then go under physical therapy, you
I was
should
going
be
to
able
ask how
to.
to get to that drive. I don't know how to get to your guys' the drive that you have with all the content.
So if you
Yeah,
go under
so go
Canvas,
for it.
okay. Okay, so if you go under Canvas and you click on Tutoring Center, and
Yeah.
then you want to click on Physical Therapy and PA Students, and then I think there's once you click that, you'll send to a page, and there's a section that says View Our Resources. And then I think if you click that, and then I think there's like the recorded these recorded tutoring sessions, and then there's like view more resources, I think, and that's where the Google Drive is going to be, I think. I
Yep.
believe
Yep.
that's how you get
One
there.
online sources. That's where you have the brachial plexus. Yeah. So if you could add the you guys' PowerPoints, that'd be sweet.
Yeah, I can work on doing that right now while Aaron's doing this.
So scroll up one more again.
You want this one?
Suprascapular foramen. Yeah, so
Right
I
here?
think that I'm pretty sure you all had a slide on this somewhere, but I couldn't find it. But basically, the suprascapular foramen is the suprascapular nerve, and where it passes through the foramen, and then the artery passes above the ligament. So the way that we remember that is the Navy goes under the bridge and the Army over, and that's what I remember seeing in yours. Uh,
Hmm.
So Navy is the nerve, and Army is the artery, and the bridge is the ligament. So that was I think we had a question on that. He kind of emphasized this point.
And
We
the
definitely had a question on that.
suprascapular artery goes to both the supraspinatus and the infraspinatus, correct?
I believe so, but I'm not 100% sure right off the top of my head.
Okay. Yeah. It looks like it.
Yes, you're right.
All right, now you can scroll down. And our teacher loved these spaces. I don't know how yours is, but all of these, I think we probably had a question about a space on almost every test, probably. So,
Yeah, anytime there's a space or a region that has like borders and stuff, like we talked about with the axilla or with the cubital fossa, anytime there's a thing where it's telling you, hey, here's borders of this or that, you want to know those things. At
Got
least
it.
that was the case for us.
right, so the quadrangular space, the boundaries, the superior boundary is the teres minor. The inferior boundary is the teres major. The lateral boundary is the humeral neck, and the medial boundary is the long head of the triceps brachii. And the contents of that, so what's within it is the axillary nerve and the posterior humeral circumflex artery. And then the triangular space, the superior boundary is the teres minor, the inferior boundary is the teres major, and the lateral boundary is the long head of the triceps. And like we said, we will send you these PowerPoints so you don't have to like
Yeah, they're
scramble
up
to write them all
already. I
down.
just did it.
Yeah.
In fact, I'll put the link in the chat. Hopefully that
Perfect.
link works.
And then the triangular interval, the superior boundary is the teres major, the lateral boundary is the humeral shaft, and the medial boundary is the long head of the triceps, and the contents of the radial nerve and deep brachial.
Yeah, I don't remember him going over the triangular interval. Maybe I missed it.
The interval is a lot smaller, so sometimes I think he said it wasn't not necessarily as not as important, but the quadrangular space and the triangular space I would definitely know. We do have this interval here, but I remember him saying it's a lot, like I said, it's smaller, so it's not,
Yeah.
But there still is those contents in there, and I would at least get to know them.
And if you have trouble doing this, I don't know, this is something that helped me. Again, it might seem kind of dumb, but I took my fingers like this and then my other fingers like this. Obviously, you're looking at your own, but like this is like the shaft of the humerus, right? And along with the shaft of the humerus, you have the lateral head of the triceps. And so that means that this space here is going to be the quadrangular space, right? And then over here is going to be the triangular space. So this would have to be the this would have to be the other head of the tricep or the head of the triceps. So just I don't know if that makes any sense. It's kind of hard to show you when you're not when I'm trying to go like this. But yeah, if you could almost use your like fingers as a diagram to help yourself along, just using your middle finger of your like right hand as the shaft of the humerus to kind of help yourself remember what's in what space if you don't have like a diagram in front of you. In fact, even like on the test, I was going like this. Okay, like what is in what space? I don't know if that makes sense, but hopefully that was helpful.
Yeah, I didn't know that one. That was good.
One of the PA students from last year showed me that.
I like it.
Do you want to go over the list real quick, or?
Yeah, we can do that. Well, do you guys have any other questions on this or anything else that came to mind? Yes, no, maybe, probably not. All right.
I have a random question.
Go ahead.
So he went off on this like major tangent today during class about injury to spinal nerves and was confusing the crap out of everyone. And I think we ended up making sense of it by the end of it, but not totally sure just because everyone was like, what the heck just happened? I'm trying to figure out, I wrote down what he was saying. But basically, like he was saying that, so after the spinal cord ends, he was saying like if there was an injury to, like L4, L5, that the nerve affected would be S1, not L4.
L5.
But that's wrong, right?
We ended up finding a picture from the book L4, L5.
Here, let me grab my book real quick.
I know there's a weird nerve down there that does something weird.
There is. He most likely was correct. He probably just explained it in the not best way. I'm trying to get to my book so I have reference. Do you know, I guess your pages are different. Do you know what page it was, Mark?
Actually, someone posted a picture in our WhatsApp. I'm going to see if I can find it. So many memes.
Okay, you said if it was an injury between which two? L4 and L5?
Yeah.
Yes.
Hmm. Yeah, I don't. That's if it was an injury
Here.
between L4, L5, it would be an S1, you said?
Yeah, but I have a picture right here it's the
Oh,
L5.
that might have
I
been
can
spondylolisthesis. Did he ever mention
he was also
spondylolysis
getting
or?
so
No.
No, that doesn't make
But
sense.
like, also it was such
he
a
was
major
even
tangent that halfway through I was like, I don't even know what he's saying. So he could have said that, and I just
he was
didn't
even
get
Okay.
it.
he was even saying L3, L4 affecting S1. Um,
Yeah.
so that's why I don't know really how to share my screen, but we have a picture of a herniation posterolateral at L4, L5, and it says it would compress the L5 spinal nerve root. So
Yes, if it is L4, L5, and it's posterior lateral, it can affect it. And here's why. Um, I don't have that picture pulled up, but I don't know if you can see my book okay here.
yeah,
So basically, if you look at where L4 and L5 is, so right there is L4, that's L5, right? So we're talking posterior lateral, right? So it's coming out from the back and to the side. But if you look at, I'm trying to see if I can show this right here. This right here, where my finger is, it's kind of hard to see, is where L4, you're saying it would affect L5 nerve root, correct? If it
yes,
was between L4, yeah. So right there is where L5 comes out. So it's coming right, it's getting L5 right at where it's coming out. Does that make sense? So not where it comes out into the vertebral foramen, but right as it's exiting the spinal cord. So if it's coming out of the back and to the side, it's having to travel down, so it's still hitting L5 nerve root. Does that make sense? Did I confuse anyone?
he was just confusing us saying that it was S1, that like anything after the cauda equina was going to be like vertebrae lower than what we thought it was.
Gotcha.
It
Well,
was
see, it still could affect S1, and it's for the same reason being. Because if you're looking at the cauda equina, see how all of these strips are still passing by? Like, if
mm,
something came out here, it's still going to affect all of those nerves because those are still in the way. Does that make sense? Did I lose
yeah,
anyone?
no.
I see Cara looks at me like I'm crazy. So,
I
let
think
me try and pull up.
oh sorry. I was just gonna say we just get really confused based on like if whether what he was telling us in lecture today was wrong or right because he like was jumping all over the place. So could you just clarify like one more time if it was L3 and L4?
it could be it could be any of them. So if you're talking about the space between L3 and L4, right? You still can affect S1. In fact, you can affect all the way down to like S5 nerve because of the cauda equina. It's essentially if you look further up in the spinal cord, you're not really going to affect the one above or below, like any too much further down because if you go posterior laterally, you're just going to hit whatever it is coming out of the intervertebral foramen. But when you get to like what Mark had mentioned that Dr. Moore mentioned in class, when you get past the cauda equina, now you don't have a spinal cord anymore. You don't have individual nerves coming off. You just have this like big tether of nerves coming off. So if it comes out, if these are my two vertebrae and this is the cauda equina here, I have all of these here, is coming out posterior laterally, it can hit any one of those nerves, whether it be L4, L5, S1. Does that make more sense now?
So yeah, so how about this? At L1, L2 with the cona medullaris, would what would that potentially be hitting?
Okay, so L1, L2, you still probably have potential to hit it just because there's still the cauda equina that is starting there, if that makes sense.
Yeah.
So if you're
But
basically above that, like, say if you're still in like
Like
the
T12L.
thoracic vertebrae, yeah, that's might be a little bit more iffy. It still could be a potential, but you're probably not going to hit any of your like S1, S2. You might hit like, again, referring to the picture. I don't know what number this is in your book. In my book, it's page 29, but this is the version behind. So it still should be within that first chapter of introduction. Um, it still might be a little bit iffy, but like for sure that if you're in the thoracic region, it's not going to be an issue. Does that make sense?
So then like C1, C2 would be damage to C1, and then T1, T2 would be.
So remember how we said that C1, C2 is a little bit like different than the other nerves? So
Yeah.
be careful with this because I can guarantee you there's going to be a question on this. If we have C1 and C2 and there's a nerve coming out between C1 and C2, what nerve is that going to be?
C2.
Between, correct. Because when we are talking about cervical nerves, those nerves enter one above. So C1 nerve is above C1. Does that make
how about
sense?
how about like a T12L1? Would that be L1?
No, because the one above only applies to cervical nerves. So if we're talking if it's a posterior lateral, like not just we're not talking about like an impingement. If there was like a posterior lateral, like what's herniation? Yes, it could possibly affect L1 because of the reason that we talked about before. Does that make sense?
Yes. I think that clarified it for me.
Okay. Did I lose anyone? Okay, hopefully that clarified what you guys learned in class with a little bit more explanation, because that can be tricky if there's not that. There's a difference between, remember, there's a difference between a herniation and an impingement, though. So if there was an impingement between, let's say, L3, L4, then what nerve are we affecting?
L4? L5?
No. Okay, if it's between L3 and L4, what would it be? 3? Correct. It would be 3 because it exits after, not before, like in the cervical vertebrae. So yeah, just get comfortable with questions like that, because again, I can guarantee you there's going to be at least one question. But again, if there was a herniation and we're talking about lumbar spine, that's going to be different because it's not just crunching the nerve in between the intervertebral foramen anymore. We're now going towards the spinal cord or towards the cauda equina. That's why posterior lateral herniations are also a big deal, like more of a big deal than, let's say, like an impingement. Because let's say, for example, let's forget about the cauda equina for a moment. Let's go back up to the thoracic region where it's a little less confusing, right? Let's say that there's a herniation and it's posterior lateral, right? Now it's touching the spinal cord. Like that's not good. So that's if there might be a question, something like that might show up too. I think that was a question for us too, that like which would be like worse, or what's the worst kind of thing that could happen to. I forget how it was worded, but yes, because that affects the spinal cord. Does that make sense?
Yeah. Mm-hmm.
Okay. Big deal. Sorry, Matthew or Aaron. I feel like I hijacked whatever you guys were saying.
You explained that super well. So.
Okay.
Yeah, I just knew it gets kind of iffy when you get down there, but it just gets a little off. So I get where your teacher was coming from, though. Any other questions?
I think I'm good for now. I think I just need to go into my Complete Anatomy app and start looking at stuff.
Yeah,
That's
for
very
sure.
helpful.
I would start looking
Also,
at
the Ackland videos are
yeah.
helpful too. Like, honestly, our
Yes.
quizzes were like all Ackland pictures.
It
So,
seems like he prefers doing the grant dissector videos in class. So I'm gonna rewatch all of them in class. I'm gonna watch the Acklands by myself now.
Yeah, it kind of
Yeah, I
sucks
don't
you
think we
guys
ever
don't
used
actually
Grant.
have to do the cadavers, but
Yeah.
I also, excuse me, I have the link to the PowerPoints that we've been saying that we had from our class. I put them into the drive, and the link to the drive is in the chat.
Were there any others that y'all might want, like PowerPoint wise, that might help of like specific areas?
I'm putting in. I put in the intro. I put in the intro. I'm about to put in the back too.
Yeah, I was
Y'all can
gonna
send
say for
whatever
now.
y'all think gonna help.
All right. But y'all haven't gotten a hand yet, have you?
I got a lot to do.
Okie dokie, guys. Well, thanks for joining us. Hopefully that helped a little bit.
Thank you so much. It was very helpful.
all right, see you guys.